Stepping into the world of fertility care can feel, frankly, incredibly overwhelming all on its own. And when you add the extra layer of worrying about an underlying health issue, like an autoimmune condition, well, that overwhelm can multiply real fast. But hey, take a deep breath. In today's explainer, we're going to walk through this together, step by step, and we'll make everything as easy to understand as possible. Navigating fertility with an autoimmune condition can definitely bring a knot of anxiety right to your stomach. And I want to pause for a second and just acknowledge that. Your anxiety is perfectly normal. But more importantly, you are absolutely not alone here. So many individuals and couples navigate this exact same intersection of health and family planning every single day. So today, we're going to clearly map out the science. But we're also going to map out the highly hopeful, medically supported path forward. Section 1. What is autoimmunity? Okay, let's start with this foundational definition. An autoimmune disease is, simply put, a condition where the body's immune system mistakenly attacks its own healthy cells, tissues, and organs. I actually like to think of it like this. Imagine your immune system as a highly trained, deeply loyal defense team, right? Their only job is to protect you from outside invaders. But with an autoimmune condition, this defense team just gets a little confused. It temporarily loses its ability to tell the difference between a foreign invader and your own perfectly healthy tissue. So remember, it's not your fault, it's literally just a biological mix-up. Now, you might be wondering, what actually causes this? Well, while the exact singular cause is still a bit of a mystery, we do know about a few potential triggers. There might be a genetic predilection, meaning, it can run in families. Other things like certain bacterial or viral infections, specific chemicals, or even environmental irritants can play a role. The big takeaway here? It's a really complex mix of genetics and environment. Again, absolutely nothing you did wrong. To bring this a bit closer to home, let's look at a few common autoimmune conditions. We're talking about things like diabetes, autoimmune thyroid disease, and systemic lupus erythematosus, which you probably know as lupus. If you're dealing with one of these, you are in exactly the right place. See, these specific conditions are frequently associated with reduced fertility, which is exactly why medical experts have spent so much time figuring out how to best manage them when you're trying to grow your family. Section 2. Impact on your fertility. Before we dive into the mechanics, let's quickly demystify some of that medical jargon you might hear in the doctor's office. First up, the endometrium. This is just the medical term for the lining of the womb. And this lining is super crucial because it's exactly where a fertilized egg needs to implant and grow. But when an autoimmune response happens, this delicate lining can sometimes get caught in the crossfire of that confused immune defense we talked about earlier. And that can make it a bit harder for an embryo to successfully implant. Another really vital term you'll hear is ovarian reserve. This simply refers to both the quantity and the quality of eggs a woman has at any given age. Now, here's the thing. When an autoimmune disease specifically affects the ovaries, this ovarian reserve can actually get prematurely reduced. Basically, it could potentially shorten a woman's reproductive lifespan. Now, I'm not telling you this to scare you. No way. I'm telling you this to empower you. It highlights exactly why getting proactive, timely medical guidance is such an absolute game changer. And hey, this brings us to a really common misconception. The idea that fertility struggles related to autoimmunity only affect women. Not true at all. Autoimmune disorders can actually impact reproductive organs in both sexes. While in women, it targets the ovaries or the womb lining, in men, it can affect the testes. Just like a woman's ovarian reserve can be impacted, a man's sperm count can also drop prematurely due to these conditions. It's very much a shared journey, right? Both partners absolutely deserve thorough evaluation and care. Section 3. Your collaborative care team. So, because the exact causes of these conditions are mostly unknown, that means there isn't one single magic pill or specific treatment. But please, hear this loud and clear. A lack of a single cure does not mean a lack of a plan. Not at all. Modern fertility care providers know exactly how to manage this. They have robust, proven strategies to guide you safely and effectively right towards your goal. Let's actually look at what that roadmap looks like. Step 1, getting an accurate diagnosis of the underlying autoimmune condition. Step 2, and this is absolutely critical, making sure that condition is well managed and incredibly stable before you even begin fertility treatments. It's kind of like preparing the soil before planting a garden, You want the environment to be as calm and welcoming as possible. Then, once things are stable, you move to step 3, collaborative fertility treatment that's tailored uniquely to your own body. I absolutely love this quote from our source material. It says, specialist opinion from a fertility doctor and a rheumatologist can guide individuals with autoimmune disease during their journey of trying to conceive. This is literally the golden rule here. It shows just how crucial it is that your fertility doctor doesn't just work in a silo. They need to be in close, active collaboration with a specialist physician, like a rheumatologist or an endocrinologist. When your fertility expert and your autoimmune expert are actually talking to each other, that is when you get the absolute best, safest outcomes. You're basically building a dream team whose sole purpose is your success. Section 4. Finding hope and moving forward. If you take away just one core message from today's explainer, let it be this. Timely diagnosis and management before fertility treatments absolutely improves your chances of a successful treatment and pregnancy. This is the ultimate message of hope, straight from the medical experts. It proves that while autoimmunity definitely adds a layer of complexity, proactive collaborative care truly works. You do not have to choose between managing your health and chasing your dream of having a family. With the right plan, they absolutely go hand in hand. Which brings us to our final empowering thought. With the right collaborative team wrapping their expertise around you, your path to parenthood isn't just some far-off dream. It's entirely possible. You've got the knowledge now. You understand the roadmap. So the only question left is, are you ready to reach out, build your collaborative care team, and confidently take that very first step? Thank you so much for exploring this with us today. You've totally got this, and we're wishing you all the hope and success on your journey ahead.